Menopause. There is something almost nobody talks about, something that many are embarrassed to ask their doctor. Yet it affects nearly every man after 55. How to masturbate safely as you get older. Yes, it's normal. Yes, it's healthy. And yes, you can absolutely continue, if you do it correctly. Because here's the truth. After age 60, the male body changes, the skin becomes thinner. Circulation slows, testosterone drops, and the prostate becomes more sensitive. If you continue with the same habits you had at 20 or 30, you can accidentally cause irritation, erectile fatigue, prostate discomfort, temporary loss of sensitivity, even short-term erection problems. As a urologist, I see these consequences every single week. So today, I'm going to explain 3 serious masturbation mistakes older men must avoid, and how to do it safely, confidently, and without embarrassment. Let's begin. Why this matters after 60. After age 60, your body goes through 4 major changes. 1, blood flow to the penis naturally decreases. This means erections take longer, and friction can cause more irritation. 2, testosterone is lower, so stimulation needs to be gentler and more deliberate. 3, the prostate enlarges for most men. This makes pressure in the pelvic area more noticeable. 4, skin elasticity reduces, which means the old rough methods can actually cause micro-injuries. Masturbation is not dangerous, if done with the right technique for your age. Mistake number 1, using too much force or speed. This is the biggest mistake older men make. When you were younger, you could be fast, rough, or careless and the body tolerated it. After 60, high friction can lead to redness, soreness, temporary numbness, delayed erections the next day, pelvic tension. The safe way, use a slower rhythm, steady pressure, and deliberate movement. Men over 60 should aim for 10-20 minutes instead of short, aggressive sessions. Gentle grip, avoid tight squeezing or bending. This protects nerves and supports healthy blood flow. Mistake number 2, doing it with no lubrication. This is a huge mistake for senior men. As estrogen increases and testosterone decreases with age, skin moisture reduces. Dry stimulation causes friction, which triggers micro-tears, burning sensations, sensitivity loss, longer recovery time. The safe way, use a natural, non-irritating lubricant. Aloe-based, coconut oil, water-based lubricants, even olive oil if your skin tolerates it. Avoid anything scented or warming, those often irritate older skin. Mistake number 3, ignoring the prostate and pelvic floor. Most men don't realize this. When you masturbate in your 60s, you use your pelvic floor muscles much more than when you were young. If these muscles are weak or tight, you may experience loss of erection halfway, weak ejaculation, lower intensity orgasm, pelvic ache afterward. The safe way, before starting, do 30 seconds of pelvic relaxation. Breathe deeply. Relax your lower stomach. Don't squeeze your pelvic floor. Let the area soften. If you tense up too early, you reduce blood flow. After finishing, stretch your pelvis by lying on your back, knees bent, relaxing your hips for 1 minute. This prevents next day soreness. Healthy habits that improve masturbation after 60. Here are urologist-approved practices that make the experience safer and more satisfying. 1, warm your hands or take a warm shower before. Warmth increases blood flow to the penis and relaxes the pelvic floor. 2, use both hands or change technique. This prevents repetitive strain and protects sensitive areas. 3, don't rush the climax. Older men need more arousal time for full circulation. Position matters. Avoid sitting on hard chairs since it compresses the prostate. 5, if you feel burning, stop. This means friction is too high. Is masturbation healthy after 60? Yes, here are 5 benefits. Based on medical research, healthy masturbation after 60 can reduce prostate congestion, lower stress and improve sleep, maintain erectile tissue elasticity, improve pelvic floor coordination, boost mood and testosterone slightly. It's safe, natural, and beneficial as long as you avoid the 3 major mistakes. A real patient story. One of my patients, Jean, age 67, came to my clinic complaining of soreness after masturbation, weaker erections, temporary numbness. He thought something was wrong with him. He was embarrassed to talk about it. After discussing his habits, I discovered he used no lubrication, he rushed, he squeezed too hard, he tightened his pelvic floor the whole time. I guided him to the techniques I just shared with you. 2 weeks later, he returned and told me, "Doctor, everything feels better. I didn't know it could still feel this good at my age." His confidence returned. His relationship with his wife improved, and his anxiety disappeared. You can experience the same safely and confidently, important and respectful. Men, listen. There is nothing shameful about self-pleasure. It is part of your health, your emotional well-being, your blood flow, and your prostate function. But after 60, you must adapt your technique to your body. Avoid rough speed. Use lubrication. Relax your pelvic floor. Protect your skin and nerves. This is not just about pleasure. It's about protecting your long-term sexual health. If you found this helpful, share it with another man over 60 who might need this information but is too shy to ask. Stay healthy, stay confident, and take care of your body at every age.